which is specifically whether they sought treatment for the child who had fever in the last 2 weeks, and whether it was done on the same day or the next day, which is within 24 hours. And the questions we used for this particular survey were adapted from the malaria indicator survey as well as the IMACIDA survey from Mozambique to help us get some, because these surveys are piloted and we also adapted them as needed. So in terms of analyzing the data, basically people who said that they had heard the Intensal campaign radio messages were treated as being exposed to the campaign. And when I did the analysis, what I looked at was there a difference in treatment seeking for the child if the caregiver had heard the messages and compared those with people who may have not necessarily heard the messages. And this is what I did using adjusted logistic regression analyses, adjusting for various confounding factors. So as you can see in the key findings, what we found is majority of the participants in the survey were the mother of the child, and 41% of the people had radios. But listenership was higher than that, which was 70.5%. My slide has disappeared. Okay, it's back. Thank you. So of these 70.5% people who were listeners of radio, what we found is 70% of them reported that they had actually heard the Intensal radio messages. And overall, 94.5% of people said that they actually did get treatment for their child who had fever in the last 2 weeks. And 51.7% of people had done so within 24 hours. But if you look at the graph, which is at the bottom in the middle, the blue bar shows 57.2% of people who had heard the radio messages of Intensal had taken their child within 24 hours, whereas this was a bit lower among people who had not heard the radio campaign, and which was 45.3%. And this difference was statistically significant. So essentially what we found is that the exposure to our radio campaign was high in this population, and it did have a positive impact on timely treatment seeking for fever among caregivers of children under the age of 5. However, as you can see, that still treatment seeking seems to be quite low, and future campaigns should continue focusing on treatment seeking among caregivers of children under 5. That is why DMI currently continues to broadcast messages on malaria treatment seeking, immediacy of malaria treatment seeking in Mozambique. And I want to thank my co-authors, which is Celso G, who is a senior research manager with DMI based in Mozambique, Dr. Padrino and Sergio Sabat, who work with the National Malaria Control Program in Mozambique, and Joanna Murray, who is a research director of DMI. Thank you very much for your attention.
Thank you so much, Dr. Weil. At this time, we're going to open it up for any questions. Please feel free to write your question in the chat. If you'd like to ask your question, please raise your hand or unmute yourself.
So I can see that there is a question which says, do you mean treatment seeking for children under 5 was 94.5%? And related, do you want me to answer the questions now or maybe later?
Go ahead.
Okay. And related with radio campaign or other SBC. So irrespective of looking at the differences between whether the people had heard the campaign or not, overall 94.5% of population had actually sought treatment for their child. And the issue with malaria is not necessarily that people are not seeking treatment for their children who have fever. The issue is whether they're seeking it in a timely manner. And given that the falciparum plasmodium is the cause of malaria among children in Mozambique, which can be quite fatal and escalates really quickly, it is recommended that the children should be taken to the health center immediately. And I think that's why we decided to look at the second indicator, which is about whether the child is being taken for healthcare in a timely manner. Because just going by the first indicator, it falsely makes you feel that people are seeking treatment, which they are, but missing the important point whether it's done in time. I hope that answers your question. Thank you.
Thank you so much, Dr. Weil. I have a real quick question as we wait for others to enter those in the chat. It looks like under methods, you've got a cross-sectional end-line survey. Does that mean that there was a baseline survey to start?
We did a baseline survey. The basic purpose of the baseline survey was essentially to inform the development of the campaign as well. So we did the formative research and found out what the barriers were. And subsequently, we also did a quantitative survey to understand what the prevalence of those particular barriers was, just to help us really hone in on which messages we want to disseminate through our campaign. And Mike, also to point out that also helped us understand that even at baseline, the prevalence of treatment seeking was extremely high, but it wasn't necessarily reflected in the mortality figures or the morbidity figures in children with malaria in Mozambique. And that's when we that's when we decided that we do need to have indicators that actually drills down a little bit more. And the second indicator is really important to understand the nuances of this. So there's a question which says, based on formative research, did you find barriers varied by geographic region? And did the radio messages vary as well? That's a really good question. We did not conduct formative research nationally. However, we did do the formative research in 3 provinces in Mozambique. And while there were some differences about whether a child gets convulsions because of witchcraft and other issues which were more prevalent in certain regions than others, the main issue what we found was, as I said, about a delay in the child to the healthcare center, and that's where we decided to focus on factors which were a lot more generic, and we felt would be useful in terms of promoting the key message. So, which behaviors did your radio messages address specifically apart from going to the hospital? Again, a very good question. So, the radio messages specifically talked about what are the one is emphasizing that malaria can be fatal for your child, because as I said, the perception in the community was that, oh, children get fever, they do get malaria, and that's fine. But at the same time, mortality due to malaria in Mozambique among children under 5 is really high, and incidence of malaria in children under 5 has remained at 40% since 2011. So it's very important for us to emphasize what malaria is, what it can do to the child, and what you need to do. Basically, we focus on awareness, we focus on perceptions, and we focus on action, which is taking the child to seeking care, which is the main behavior we want to promote, but nested in the pathway of making people understand why that's important.
Thank you so much. I wonder if I could insert a question here as well. In your cross-sectional survey, did you ask how many times the respondents had heard messages? And if so, were you able to determine any sort of dose response as to increasing exposure to messages and increasing behavior reported?
That's a very interesting question, Mike, and essentially it links quite tightly with, so I'm going to take a step back, but I will answer the question. So the theory of TMI is that we broadcast each message several times a day, roughly 6 to 10 times every day. And we broadcast several messages over a period of 2 years. So it's very difficult for us to measure each particular message, how many times the population heard. However, what we did is we asked people how often they listen to the radio. So once a week, more than once a week, etc. And based on that, the intention was to do a dose response analysis. However, most of the listeners of the radio ended up being in the category of listening to radios several times a day in the week. And so the nuance that I was hoping to get to understand dose response relationship, I couldn't really, I didn't have that many numbers. If it was a bigger sample size, and if that was one of the key questions we wanted to address, then I might have had the power to do that analysis. But hopefully, as I said, we are doing IntenSouth 2 now, where we are working on the same malaria, pneumonia, diarrhea questions, and we are doing a much bigger survey. Hopefully, we should be able to, well, not hopefully, I hope to be able to look at this response and impact related to that.
Thank you so much. And we'll take one more question before we're jumping into the next presentation.
So can the SBC approach help, can the SBC approach help in designing better targeted messages addressed not only to people directly concerned, but also to those who influence inadequate behaviors? Which behaviors? Sorry, I didn't really understand that question. I'm really sorry, but I will respond to that later. And then low radio ownership affect radio message reaching to persons who needed it the most. So as I mentioned, that even though ownership was 41%, listenership of radio is mentioned is roughly 7.5%, and among people who listen to the radios, those who had heard IntenSouth messages was also 70.5%. So I think, you know, compare as we have tried to when we did the analysis of the radio reach in Mozambique, we did take into consideration how we could maximize our reach as much as possible. And that is why we not only broadcast on Radio Mozambique, which is a national radio station with provincial radio channels, but also work with 30 community radio stations in order to enhance exposure of the campaign, but also broadcast these messages in local languages, which is equally important to not just reach, but also make the messages more accessible, so to say, to people listening to them. I'm not sure if that answers the question, but happy to answer any if you have any follow-up. And I'm really sorry, as I said, I didn't understand the question, which is about this one from Jacinta, which is the second question. I'm really sorry about that. Thank you.
Thank you so much, Dr. Weil, for your presentation. Unfortunately, Dr. Umunia had an emergency today and was unable to join us. So we're going to move to our next presentation.
Thank you, Mike. Thank you, everybody.
Without further ado, I'd like to introduce Susie Emiliano from Population Services International in Angola.
So hello, good morning, afternoon, or evening, everyone. As Mike said, my name is Suze Emiliano, and I am the Marketing and Communications Director for PSI Angola, working closely with Angolan NMCP in all malaria SBC efforts in country as part of our PMI funds to work in Angola. So what I will be speaking to you today, it's about our Zero Malaria Começa Comigo communications campaign, which I will refer for the purpose of time as the MCC campaign. And this campaign was initially launched in May 2020. So during a very restrictive lockdown that we faced in Angola in the beginning of the pandemic. So we had to suspend all interpersonal communication activities following both WHO and RBM recommendations. And we started navigating into the digital landscape, integrating malaria messages with health promotion, maternal and child health together with COVID-19 topics. What we saw since the beginning is that the page had an immediate fast growth rate. And the reach was impressive since the beginning and now goes up to millions of Angolans that are reached by the campaign. And what we try to do more and more with the page is that this is not a standalone communication piece, but this is part of an integration of all kinds of interventions that we have. So it includes mass media, it includes interpersonal communication, the involvement of religious and traditional leaders. So it includes everything. And what I'm presenting here is the digital part of it as the most innovative piece of this campaign. So as I was saying, since May 2020, Angolan social media users are daily reached with high quality, user-friendly and reliable malaria prevention messaging through our page. What we do is using a one-stop shop methodology in a way that the digital posts that we put on Facebook and Instagram address the determinants of the 3 key behaviors we are promoting. So the 3 key behaviors of our campaign are the consistent sleeping under a bed mat, the prompt care seeking, especially for children under 5, and the prevention of malaria in pregnancy. So what we do is addressing the determinants of these 3 behaviors using a lifestyle approach in the way we frame the messaging and contextualizing these behaviors into the day-to-day reality of Angolans. And of course, that since 2020, it is impossible to disconnect anything in our lives from the COVID-19 context. So as I said before, we integrate the malaria messaging with health promotion, maternal and child health messages, and also COVID-19 prevention and vaccination messages, amplifying community well-being and care approach of the digital communication campaign. And as you can see in the images that we selected to this kind of poster, and these 3 images were already posted on our pages, we try to enrich our content with images that are taken from community awareness sessions and engagements, or real pictures that we take from the field activities or from medical appointments where we do, for example, supportive supervision, so that we kind of strengthen the connection between the viewer and what's on the page. So jumping a bit into the results of this page, and we specifically selected 2 results to put or to highlight in this communication. But since the launch, we can say that the Facebook page has reached all Angolan users digitally connected to Facebook. So we know that we have over 3.5 Angolan people who are connected to Facebook in Angola, and our reach is over 3.7 million. It means that everyone who has a Facebook account registered in Angola was already in touch with our messaging, and our malaria prevention messages spread through this page. One important thing, and it was surprising for us at the beginning, is that malaria in pregnancy consistently drives more engagement, particularly regarding the IPTP-SP uptake and its side effects management. So when we specifically analyze the malaria in pregnancy posts, we see that they register over 20,000 engagements per post, which is kind of impressive. And there is an automatic conversation between the users and between our page managers regarding the management of side effects and sharing of experiences from women to women on how they do this management and how they react to the presence of these side effects. So as I was saying, the page interacts with people all over the country who daily comment and react to the posts that we put on the page. If we look at the median engagement rate for Facebook in general, we see that the global statistics points at 0.064%. When we look at the engagement rate in our page, we see that it is consistently above 7.5% and often gets to 16%, meaning that from all our users reached by the post, 7.5 to 16% of them engage with the specific posts, either putting questions, commenting the content, sending private messages with questions, or just sharing thoughts. And this is a very good result because it allows us to compare the performance of our page with the performance of Facebook in a global perspective. And if we analyze, so we have a software that we use to track the performance of the page, that is Social Bakers, now called Amplify. we see that the MCC growth rate, and you can see that on the graph that you have on the right side of the slide, the growth rate of this page is 10 times higher than the benchmark for Angolan Facebook pages. So we register more or less 2,000 new followers a month. And as you can see in the graph, the generic average of Facebook Angolan pages is much lower than this performance. Our highest reach is among 18 and 35 years old population, which represents 50% of people reached by the page. And these people interact with the posts more or less 831 times a day on average. So as we put on the blue box at the top of the slide, although social media is yet to get widely disseminated, for example, in rural areas, so we know that we are not responding to this particular part of the population, but the MCC with Facebook, we are responding with other interventions, but Facebook page is an undeniable, powerful channel to reach digitally connected urban communities with malaria prevention messaging. So as closing of my communication, and apologies if I'm speaking too fast, I'm trying to be mindful on timing. We would like to say that one of the key takeaways is the integration of health areas in one specific interventions so that people find relevant information in the same source. Another one is the contextualizing the information to what's happening in country so that people keep being connected with the information, using user-friendly language. And of course, we know the limitations of digital channels. So it's important to look at this intervention, as I said in the beginning, as part of a 360 campaign that has other kinds of interventions. And before I move to questions, I would just like to acknowledge my colleagues who were developing this poster together with me. So first, I would like to say thank you to Dr. José Martins and Dra. Fátima Henriques from the Angolan NMCP. Also to Joana do Rosário and Arciolanda Gravata from PMI Angola. And last but not least, my colleague Binamen Chipandeca from PSI Angola Communications team. And I'm happy to respond to any questions.
Thank you so much, Susie. The first question that we have is whether or not these posts on Facebook were organic or boosted, and did you use any other digital platforms?
Sorry, Mike, I couldn't understand the last part of your question.
The first was whether or not there were paid advertisements or if they were organic. And the second was, were there any other digital platforms that you used or only Facebook? Okay,
thank you. So some of them are organic and some of them are boosted. So it really depends. It really depends on the post and on the management of the budget for the page. I can also say that we have like a twin page of this one that is Zero COVID Começa Comigo. And actually on this page, we won recently $5,000 award from Facebook because of a contest that we won with the video, and we are having like Facebook paying for the boosting of our content in these months, which is really cool for us in terms of budget management. But just to say, some posts are boosted. For example, we boosted the TV spots that were on TV. We also put them on Facebook, and with videos, we know that if we do not boost, we do not achieve huge reach. So for example, the videos, they were boosted so that we could connect the interventions. And speaking on other social media platforms, we have a twin Instagram page. So everything that goes on Facebook goes as well on Instagram for this. We are trying to enter a new space on this page that is hosting live events where the population can live engage with technicians and health professionals who are speaking on the page. But this is a novelty that we will introduce on this page in the beginning of the upcoming fiscal year. So hopefully next week. I hope I responded.
Thank you so much. And we'll try to squeeze in 2 more questions here before they call us back. One question here is can you tell us a little bit more about the different kinds of posts? It sounds like you mentioned that there are different, whether it's images, videos, but we're also maybe there was podcasts or something like that. And then my second question to just add on top of that did you use any sort of advanced or simple audience segmentation when designing these campaigns on Facebook, or was your target to was the idea to reach as many people as possible without segmentation?
Yes, so in terms of types of posts, the vast majority of posting on this page, on these platforms, is illustrative imaging, as the ones you are seeing here, with simple user-friendly message that can be of 2 types. We have like informative posts where we put the information that people need to receive about a particular behavior in a user-friendly language, or we have engagement triggering posts where we kind of put a question and then we see the debate happening between the users with their comments and questions, and the communication just flows. And we also put here the TV spots that are produced for TV. And what we started doing is a 3rd category of posts that is daily news from the field. So the ITN distribution campaign is ongoing, and we receive pictures on a daily basis from all parts of the country where the ITN distribution campaign is happening. And we put them the day after on the page so that we can also push for local driven engagement from the communities that are seeing themselves represented here. So this is the majority of the post types. And I forgot your last question. I'm sorry.
No worries. Thank you. Actually, we're going to have to wrap this up really quickly. Thank you so much, Dr. Weil and Susie, for your presentation. We're going to be rejoining our colleagues back in plenary for the final presentation of the virtual forum. It's an interactive session on the future of SBC and working group. In a minute, you're going to see a pop-up on your screen asking you to rejoin plenary. Just as a reminder, for any reason, if you're disconnected during this process, please rejoin using the Zoom link used to join us at the beginning of today's virtual forum sessions. Thank you all once again for your participation, and we'll see you back in plenary shortly.